早晨，大家好，歡迎大家嚟。
Good morning, everyone. Welcome to our ICON Health Forum, which is conducted in Cantonese. The topic is Stroke Smart.
First, we do learn acknowledgement. We want to say that UBC is located on the traditional, ancestral, and ceded territory of the Musqueam, and UBC operations are also on the territories of the Squamish and Tsleil-Waututh. We also like to acknowledge that you are joining us today from many places near and far, and acknowledge the traditional owners and caretakers of those lands.
我係何陳宇慈 Barbara Ho， 係一名註冊護士，亦都係安康健康網絡首席護理主任。今日咧，我係你大會嘅主持人。網上嘅朋友，大家好，歡迎大家嚟參加今日嘅安康線上中文講座嘅。呢個係誰有中風危機，應如何處理？
Now, simply put, I want to give you an introduction of ICON because some of you are first-timers. ICON is an initiative by the UBC Faculty of Medicine, the Digital Emergency Medicine, and the executive director is Kendall Ho. We've had this for 19 years. We also thank patients as partners, as our partners. We wanted to convey reliable and useful information to communities, to the indigenous citizens in BC, as well as family members and patients, provide them reliable and relevant health information on prevention and care of illnesses using technology so that they know how to manage, find technique to manage and lower the risks of having these illnesses. At the same time, we also will provide electronic apparatus, apps to the community to help them on improving health. Today we have many speakers. The first one is Dr. Samuel Yip. Dr. Yip. He is now the Clinical Associate Professor of Neurology at UBC. He's also one of the directors as well as the resident doctor in UBC. He completed his medical doctor's degree at UBC and also at the University of California in San Diego to do some research on stroke.
工作咧係
he maintains stroke prevention and also treatment and also training new next generation neurological doctors. Welcome, Dr. Yip. Hi, how are you? Thank you for taking the time off from your busy schedule to let us know what is a stroke, whether there's any new information to be given to everybody. I'll hand you the mic. Okay. Today we're talking about, hopefully I can finish in 20 minutes. I'll be able to let you know to understand what is stroke and to understand the signs and symptoms. And you can identify the modifiable and non-modifiable risk factors and prevention strategies. And also learn how to do what to do when you suspect it, and also the process in the hospital. At the beginning, we want to know what is defined by stroke. Actually, there are many types of stroke. One of them is called transient ischemic attack. Actually, you can think of it as a more minor, shorter time duration stroke. because of this focal brain or retina ischemia without infection. So the blood vessel, the sending the blood to the brain or the retina temporarily is impacted, so there's no blood to the brain, so the function is affected. So it's not like a stroke. Doesn't cause permanent harm, but the symptoms and signs similar to a stroke. It's just that time duration is briefer. So symptoms can feel that half of your body can move, or you can feel your speech function is reduced. You can't tell people clearly what you want to say, or you don't understand what other people are saying, or maybe you're slurring your speech, or your one eye vision in one eye perhaps is maybe pulled down, or maybe half of it is unable to see. This is all the signs of stroke. But temporary stroke, TIA, the time duration is shorter. Maybe it will last for a few minutes, or maybe an hour. Usually it's a few minutes or 10 minutes, then that's the end. But sometimes the same thing might happen again. So this is also a warning sign of stroke. So if you have that sign and symptom, don't ignore it, because you don't think of it just a few minutes or several seconds, and you treat it as nothing. Actually, maybe this is your next stroke in the future. Usually, I call it a minor stroke or ischemia. If the next stroke in the next month, there will be a 20 to 30% chance of happening again. So it's high risk. So if you have that sign, you must go to the hospital or talk to your family doctor. And also, another thing is, stroke itself. What is it? Is focal neurological infection, or maybe there's hemorrhage, or the blood vessel burst affecting the brain neurological function to function normally. This is a sudden happening. Actually, there are two types. There is ischemic stroke, and the other one is hemorrhagic stroke. Ischemic and hemorrhagic, with the temporary deficient of blood in the brain is similar. It's just sudden. It's just that the duration, TIA, is more temporary. Stroke is long term. Also, it will make you cause you permanent brain injury. I just said earlier, stroke can be classified into two types. One is ischemic. Is more common. It's about 80% of the cases. The reason being that the blood clot forms in the brain, or travels from the heart to the brain, though causing the blood cannot go to the brain to provide oxygen. So the part of the brain cannot function normally. Usually the reason being atrial fibrillation or plaque buildup, causing infection in the blood vessel. The other type of stroke is hemorrhagic. Hemorrhagic could be bursting of the blood vessel in the brain burst or rupture. The blood goes to the brain. Usually is due to high blood pressure or rupture aneurysm, because aneurysm ruptured. Or another one that you may see is when there's blood thinning medication misuse. You shouldn't misuse that. That will increase the risk. In BC, every year there's about 4,900 to 5,000 people need to be hospital because of stroke, and the mortality rate is about 13%. And I just said earlier, 80% are ischemic and 20% is hemorrhagic. Early treatment can reduce disability and death. Stroke is a major cause of disability in BC minors. If it can be rapidly assessed and treated, these are key to rehabilitation and recovery. I just mentioned earlier, if you want to avoid a stroke, there are some risk factors. Some are non-modifiable risk factors, not changeable. Some are changeable. Non-modifiable risk factors as your age, if you have previous stroke or transient ischemic attack, that would also be a risk factor. Your gender, your ethnicity, family history, they're all they would increase the risk factor. Other risk factors are modifiable risk factors. As for instance, hypertension, hyperlipidemia, smoking, cardiovascular disease, diabetes, obesity, high cholesterol, physical inactivity. These are all they all increase the odds of having a stroke. Going back to hypertension, hyperlipidemia, sometimes there's no sign, no symptom. Sometimes diabetes also may not have any symptom. If you have these diseases and you're not aware, or if you don't take your medication to control, then you will increase your risk of stroke. Sometimes you may not have the symptom, or you say, okay, I'll ignore it. I don't want to take medication. By the time you have a stroke, that it may be too late. So I tell my patients is those even though you don't have any symptoms, disease without symptoms, hypertension, hyperlipidemia, diabetes, you have to take your medication. Another is modifiable risk factors. Atrial fibrillation. Sufferers who have atrial fibrillation, they have 3 to 5 times greater risk for ischemic stroke. More than 20% of all strokes are caused by atrial fibrillation. This also, there is a very good medication could reduce the risk of stroke. If you have atrial fibrillation, they have to listen to their doctor to take the medication, blood thinner. I want to say repeatedly when stroke, what's how it usually affects daily life. There are different parts in the brain. Different parts affect different function. Sometimes it's speech, some is your vision, your memory, some parts control your movement of your eyes and body movement. Different parts of the brain affected in the brain, then there'll be different consequences. The most common is the face, arms or legs not able to move or numb. If your left brain has a stroke, then your right arm or face or legs may be weak or numb. speech is difficult or unable to say what you say, or you do not understand what other people are saying. Most people having that is because the left brain having that, because the left brain controls speech. So if that side is affected, so it will affect your speech, or maybe you're unable to convey your message. And also vision loss, I just said earlier, it's just a curtain on one eye coming down. If that happens, even though it's just one eye, maybe after 2-3 minutes, maybe the drape is pulled up. This may be a sign of stroke. If it happens, you should go to the hospital. Or perhaps suddenly half sight or half vision, you can't see. You could see what's on the left and not on the right. So it could be the back of the brain, the part that controls vision has got some trouble. Another type is sudden onset of severe headache. I never had any severe headache before. Perhaps just like in a second severe headache that's never experienced before. So perhaps it's also this bursting of rupture of an aneurysm prelude. So if that happens, you should go to the hospital right away. Other maybe dizziness or loss of balance. I'm not talking about a light dizziness. I'm talking about like the world is spinning. And that if you have other symptoms, numbness or double vision, or I'm saying if you have double vision, or you're slurring your speech, or you feel that you have problems swallowing, or when you walk you are leaning to one side, this could be symptoms of stroke. You must go to the hospital right away for help. Actually, I just said earlier there's many symptoms. The simplest, you can use that logo to remember. I call it FAST. FAST represent the face. If your face suddenly droops, are not balanced, a sudden onset, like usually is balanced, suddenly one side of the mouth droops, or at the same time you can check if other people, you can raise your arms to see whether your arms, whether you're unable to raise one arm, or maybe one arm falls down slowly. There's A is for arm. The third is speech. Whether speech is clear, whether you are clear enunciation, or maybe you can say things that you want, or maybe words that come out are jumbled up, but you can hear people speaking, but you don't understand what they're saying. This may be a symptom of stroke. If any of those three happens, it's time to call 911. Right away call 911, because there's a professional team. If 911 knows it's a stroke, and then it's the first 6 hours, they will send you to the specialized stroke treatment hospitals. When you go to the hospital, call 911 when you arrive at the hospital. There's a multidisciplinary team like doctors, nurses. First few days, the first day at the hospital, it will be the intense ICU emergency doctors and taking care of the stroke patients and nurses. The beginning, when you're at the emergency, those would be treating the patient. We hope in the shortest period of time. In an hour, we could give the patient appropriate treatment medication to reduce the disability afterwards. If unfortunately there's a stroke and then once one is in the hospital, there will be a group of a team of professionals to help with rehab, doctors, nurses, physiotherapists, occupational therapists, speech language pathologists, and social workers. They all can help you. Actually, after a stroke, you not only need to know why you had a stroke, using appropriate medication to reduce the risk of the stroke, and also we hope to help the patient recover through the rehabilitation. And also, I hope that at the time of the hospitalization, it could be reduced, the complication of a stroke. What are the complications after the stroke? Maybe cardiac issues, depression, swallowing problems, unable to eat, or perhaps you lie down too long in bed. There will be bad sores. After lying in bed too long, there might be blood clots in the legs. Accumulate in the legs, causing risk to life. So coming to the hospital not only is for the support the stroke, but also to reduce the complication that may be caused by a stroke. The medication taken usually, if it's ischemic stroke, usually use anti-platelet medication, also treatment for filial fibrillation, and also usually used to reduce cholesterol, statin type of medication, and also to control blood pressure. In terms of lifestyle, not only taking medication, we hope patients would change their lifestyle to reduce having another stroke, including quitting smoking, healthy diet, less salt food or high salt food, reduce blood pressure, less red meat. Protein is mainly in white meat, so more vegetables, fruits, and also more exercise. We want the patients to do 30 minutes a day of exercise apart from walking on level ground, and that's okay. Cut down on alcohol intake. The best is to stop drinking altogether. Sometimes maybe for celebratory reason, maybe 6 ounces in a week. 6 ounces in a week. That's a small glass. Hopefully, you will reduce another stroke through the lifestyle change. Hopefully, you will reduce another stroke risk. After a stroke, I just said earlier, there must be early rehabilitation. The earlier rehabilitation, it means a better recovery. So you can see, after being hospitalized, we hope the patient will start moving as soon as possible. And with the physiotherapists, they could do either mobility balance, and also get physiotherapy as soon as possible. And also occupational therapy. So we'll look at the daily tests, see whether any help is needed. Cooking or going to the washroom is a daily task. that whether the person can do that. So more training is done. Hopefully they'll regain the functions. Speech-wise, a lot of people after a stroke, maybe they are unable to speak or may not know what people are saying. So the speech language therapy sometimes is not just unable to say it, but what is said is too slurred speech or so difficult pronunciation. The speech therapist could help patients to speak clearer. I said earlier, after a stroke, there's a high risk of depression or anxiety, anxious, so that needs psychological treatment. After the stroke patient, I said earlier, apart from doing physiotherapy to go according to doctor's suggestion on the diet and medication, attend rehab sessions regularly. If you are not in the hospital, when you go home, you should continue doing that. If you don't, the symptoms may recur. I said earlier, eat healthy meals, avoid smoking and alcohol, monitor blood pressure and blood sugar and cholesterol, and also stay connected with community support groups and maintain your social life. All these would help the patient to recover, to rehabilitate. Not only affect the patient, you also affect family. Sometimes the family look at the condition of the patient. If they are staying at home, they want to help. There's an odd of recurrence, so they need to know stroke warning signs to make sure the patient is taking has got medication adherence according to the way the doctor wants. Maintain a healthy lifestyle. If people surrounding you, if they are eating something else, sometimes it's difficult to maintain a healthy lifestyle. Do follow-up appointments, see the doctors, and family members also need to use the community and family support to help the patient recover. What I've just said in this forum, later on there'll be some in-depth information given to you. So I'm here. That's where I am.
Thank you, Dr. Yip, for such a very detailed presentation of what stroke is, as well as very basic information. Hopefully it will help everyone, because this is a sudden onset and all the symptoms come up suddenly. So I hope everyone by now knows about this. And if someone in your family has such symptoms, then you know how to deal with it. Here we have the ways to contact us, ICON. So if you have more questions, you can either send them by email at iconproject.org, icon.support@upc.ca, or Facebook and other media. And we also want to thank the Ministry of Health, the BC Ministry of Health Patients as Partners Initiative for their continuing support. So after we have listened to the presentations, we have acquired a lot of knowledge about stroke. Stroke is preventable, it is recoverable, and it is curable. So now we have imparted knowledge in the community so that they can reduce the risk of suffering these critical illnesses. I hope that you can spread the information to other people, and you can also view these presentations again in future after they have been posted. So I hope you enjoy a healthy and happy life. Thank you. Bye-bye.